All right, guys, welcome back to part 3 of the Neoplasia PowerPoint lecture. You're doing great. I know this is really long.
Now let's summarize how malignant cells behave, and let's review the concepts of initiation, promotion, and progression. Malignant cells do not respond to external signals. There's no controlled or uncontrolled cell division. There's no breaking. Malignant cells do not repair damaged DNA. Malignant cells have no alert signals when something goes wrong. Malignant cells do not stay within boundaries. This promotes local invasion and distant metastasis. And malignant cells do not undergo apoptosis. Notice that the carcinogen is the initiator. And if there is DNA damage, the DNA will be repaired through DNA repair genes. A DNA replication error will be normally repaired. However, failure of DNA repair is an etiology for malignancy. Mutated tumor suppressor genes, such as p53, results in DNA that is not repaired. There is then continued promotion of malignant change and progression to unregulated cell differentiation and growth and malignant neoplasms. By unregulated cell differentiation, we mean cells that neither look like nor perform like normal cells. Cancer is autonomous, out of control cell division. Autonomous meaning self-regulating. Cancer does not respond to stop signals. It doesn't need growth signals. It's totally self-regulating. Malignancy requires unrepaired genetic mutations. Mutated proto-oncogenes, in other words, mutated tumor suppressor genes, so that damaged DNA is not repaired. And then there's development of oncogenes, genes capable of bringing on malignancy. We've been talking a lot about malignancy, but let's differentiate the characteristics of benign versus malignant conditions in terms of methods of growth, control of cell division, and the ability to metastasize. Benign tumors grow and compress surrounding tissue. Benign cells stay within their boundaries, and they closely resemble normal cells. Notice how all the cells, although there's increase in number, are all contained within boundaries. Malignant tumors grow in crab-like fashion, with tentacles coming out from the center of the tumor to invade surrounding tissue. Cancer absolutely does not stay within borders. It eats through borders. It invades through borders using enzymes. Cancerous tumors invade surrounding tissues. Malignant cells do not stay within borders and do not resemble normal cells, nor do they perform the functions of normal cells. Look at this drawing. The cells are not staying within the boundaries. Cells are invading. The cells neither look like nor perform like normal cells. Control of cell division. Cancer alters or hijacks normal cell signaling pathways so that the cell is signaled to divide and divide and divide and divide. Uncontrolled cell division. This was mentioned before, but there's a gene called the Ras gene, the RAS gene. It's a protein that regulates cell division, maturation, and specialized function. It's mutated in 25 to 39% of cancers. When that gene mutates, you have uncontrolled cell division. Malignant cells do not respond to external signals, do not respond to break signals. Malignant cells ignore or do not receive signals to stop dividing. In normal cell division, there is a message to stop on a segment of a gene. And what do you notice is missing from this slide? The stop segment is missing. Loss of the stop segment promotes uncontrolled cell division. The checkpoints in normal cell division are meaningless in malignant cells. Malignancy has unstoppable cell division. The cyclins, or the checkpoints, are meaningless. The cells progress through the cell cycle and undergo mitosis. Malignant cells do not undergo apoptosis, and the telomeres don't shorten. I said, why is this a problem? Because normal cells, every time they divide, the telomeres get shortened until eventually the chromosomes unravel and the cell dies. Cancer cells have immortality. The telomeres don't shorten. The chromosomes never become unstable. And the cancer cell potentially could live indefinitely at the expense of the host. Unlike benign tumors, malignant cells have the ability to metastasize. The tumor can invade, or the tumor cells can invade the blood vessels and travel to a distant site where a secondary tumor begins to grow. There is a difference between invasion and metastasis. Invasion means to grow into the space locally. Metastasis means there's a distant tumor site, totally separate from the primary tumor. So cancer grows by invasion and has the ability to metastasize to a distant site. Let's take a few minutes and answer some review questions. The tissue was biopsied and is determined to be cancer. This image represents
a DNA mutation, carcinoma in situ, failure to respond to stop signals, or all of the above.
This represents all of the above. If it's cancer, we know that DNA mutation is what causes cancer. All of the cells are sitting above the basement membrane. That makes it carcinoma in situ. Failure to respond to stop signals is a characteristic of malignancy. Remember, cancer doesn't respond to stop signals, and it doesn't require a growth signal. Now complete this matching exercise. And as it says, you can use a match more than once.
And there are the answers. You guys can stop this here if you'd like and go back a slide and practice.
Benign tumors are encapsulated. In other words, stay within boundaries. Benign tumors do have uncontrolled cell division. That's how you get the tumor. And a DNA genetic mutation is required in order to have the uncontrolled cell division. Benign tumors are more likely to be slower growing. Malignant tumors grow by invasion. There's also DNA mutation and uncontrolled cell division. Genetic mutations, DNA mutation. Malignant tumors metastasize, meaning develop tumors totally separate from the primary site. And malignant tumors are more likely to be life-threatening. We've mentioned biopsy briefly. Biopsy means to examine tissue from a living body. And now we want to discuss why biopsy is a definitive diagnostic test for cancer. When you biopsy tissue, you get the look of the tissue, the look. Tissue is placed under the microscope and you note the look of the cells. Does the pathologist determine it's benign or malignant? And if it is malignant, how closely does it resemble the cell it was supposed to be? In other words, how differentiated is the malignant cell? So biopsy, note the look. Is it benign or is it malignant? And if it's malignant, does it look anything like the cell it was supposed to be? A variety of techniques can be used to get the tissue sample for biopsy. Some tissue is easier to get than others. Skin tissue is easy to get. Cervical tissue is easy to get because the vagina opens to the outside. Colon tissue is easy to get because it opens to the outside. But regardless, a tissue sample is needed to get a biopsy to determine whether the tissue is benign or malignant. A person has an X-ray that is suspicious for malignancy. Suspicious for malignancy means that a biopsy is needed. You need to confirm the malignancy by putting the tissue under the microscope and seeing if it has malignant characteristics. There are tumor markers that are present in some malignancies, and we'll talk about that next. But we know that the definitive diagnosis of cancer requires a biopsy. Tumor markers are non-specific and may be normal. Tumor markers are antigen or protein markers, but they may be normal in the presence of significant cancer. Tumor markers are sometimes used for screening, and we'll talk about the prostatic specific antigen, or the PSA, when we talk about reproductive disorders. But just remember, tumor markers are non-specific and may be normal in the presence of significant cancer. This slide is identifying some of the more common tumor markers, matching the tumor marker with cancers. And we'll talk about these as we talk about the various malignancies in class. But just know for now that there are tumor markers, but they are non-specific and unreliable. And this just provides a sample of the tumor markers. not a complete list. Tumor markers are nonspecific and unreliable in diagnosing cancer. However, if the tumor marker was elevated at the time of diagnosis and the person is successfully treated, the tumor marker should drop to 0 or near 0. If the tumor marker starts going up again, it suggests that there are malignant cells somewhere in that person's body producing the tumor marker. So tumor markers may be used to assess for recurrence or return of the disease following treatment.
Apologize, I got technical issues here.
I said that a biopsy would determine whether a cell was malignant or benign, and if it was malignant, how closely does it resemble the cell it was supposed to be? So let's look at that in more detail, differentiating the cellular characteristics of benign versus malignant neoplasms, resemblance to the parent cell. You can see on this slide that the parent cell is on the left and the cell on the right bears no resemblance to the cell it was supposed to be. When we talk about benign versus malignant cells, that malignant cells lose differentiation, we talk about the concept of differentiation and grading. Benign cells look like the cells they were supposed to be. Malignant cells begin to lose the look, the specialized structure and function. They lose differentiation. What is cell differentiation? Specialized cells have a special structure, function, and life expectancy. They have a specialized look, structure, a specialized function, and life expectancy. Benign cells have that. Malignant cells lose the normal look or structure. They don't function like normal cells. And remember, malignant cells do not undergo apoptosis. Malignant cells have immortality. So when we talk about differentiation, differentiation answers the question, how closely does the malignant cell resemble the cell it was supposed to be? Malignant cells lose differentiation. They do not look like normal cells. They do not function like normal cells, and they do not experience apoptosis. When a biopsy report comes back and tells you that a cell is malignant, the report will also tell you how closely that malignant cell resembles the cell it was supposed to be. We are going to talk about what it means to be well-differentiated malignant cells, moderately well-differentiated, moderately dedifferentiated, and poorly differentiated or anaplastic. And it depends on how the cell looks. How closely does the malignant cell resemble the cell it was supposed to be? If you notice on this slide, the normal reference cell, the first group of cells looks a lot like the cell it was supposed to be. The last group of cells doesn't look anything like the cell it was supposed to be. So if a report says that you have a well-differentiated cancer cell, it looks a lot like the cell it was supposed to be, but it's cancer and it doesn't function like a normal cell. If the biopsy says you have a poorly differentiated cancer cell, That looks nothing like the cell it was supposed to be, and it certainly functions nothing like the cell it was supposed to be. You've done a biopsy, the examination of living tissue under the microscope. The cells are examined under the microscope. The pathology report says the malignant cells are well differentiated. Well differentiated means the cancer cell looks a lot like the cell it was supposed to be, but it doesn't function like the cell it was supposed to be. The pathology report says the malignant cells are poorly differentiated. Poorly differentiated means the cancer cell looks nothing like the cell it was supposed to be, nor does it function like the cell it was supposed to be.
Almost there.
Now let's review. First, how was it determined the cells were malignant? Did you say biopsy? You would be correct. Biopsy is the definitive diagnostic test for cancer. The pathology report says the malignant cells are well differentiated. A well differentiated malignant cell
Looks something like a normal cell, functions like a normal cell, has DNA which repaired itself, or grows by compression. It looks something like a normal cell.
A well-differentiated malignant cell looks something and a lot like a normal cell. It doesn't function like a normal cell, it's cancer. It has DNA which has not repaired itself as a result of mutated tumor suppressor genes. Malignancy doesn't grow by compression, but by invasion. Benign tumors grow by compression. Malignant tumors grow by invasion. The pathology report says the malignant cells are well differentiated. Which of the following represents a well differentiated malignant cell? Use the reference cell for comparison. Remember that a well differentiated malignant cell looks a lot like the cell it was supposed to be. So A looks a lot like the cell it was supposed to be. It doesn't function like the cell it was supposed to be. The pathology report says the malignant cells are poorly differentiated. Which of the following represents a poorly differentiated malignant cell? Again, using the reference cell as an example of a normal cell. B looks most unlike the reference cell and would be classified as poorly differentiated or anaplastic. A or an means without, and plazo is volume of tissue. So anaplastic means there's no volume of tissue that looks normal. B is poorly differentiated, anaplastic, looks the least like the reference cell, the cell it was supposed to be. When the look of the malignant cell is reported, it's called a grade. A grade is the look. How closely does the malignant cell resemble the cell it was supposed to be? A malignant cell that looks a lot like the cell it was supposed to be would be given the grade 1. The malignant cell that looks nothing like the cell it was supposed to be would be given the grade 4. So you're grading the look. Cancer cells that look most like the parent cell would be well differentiated, grade 1. Cancer cells that look totally unlike the parent cell would be poorly differentiated and given the grade 4. Fill in these blanks.
So to summarize, a cancer cell that is well differentiated looks blank, like the parent cell, and would be classified as grade what?
To summarize, a cancer cell that is well differentiated looks a lot like the parent cell and would be classified as grade 1. Now fill in these blanks.
So a cancer cell that is poorly differentiated looks blank, like the parent cell, and would be classified as grade what?
A cancer cell that is poorly differentiated looks nothing like the parent cell and would be classified as grade 4, which is often thought of as a more aggressive cancer because it tends to be a larger tumor that is more uncontrollably dividing. There is a potential relationship between differentiation and prognosis or survival. What do you think? Fill in these blanks.
So the best case scenario for cancer is likely to be a tumor that is blank differentiated and grade what?
The best case scenario for cancer is likely to be a tumor that is well differentiated, grade 1. These tend to be smaller, more localized cancers, and they tend not to be so wildly uncontrolled in their cell division. Match the image with the grade.
All right, so pause here until you figure out your answers, and then I'm going to move on to the next slide.
Match the image. Did you notice that grade 1 looks the most like the cell it was supposed to be? And grade 4 looks the least like the cell it was supposed to be. Now match the image with the differentiation, the grade with the differentiation.
Again, you can pause the slides here until you're ready.
Did you notice that grade 1, which is C, is well differentiated? It looks the most like the cell it was supposed to be. And A, which is grade 4, is poorly differentiated or anaplastic. It looks nothing like the cell it was supposed to be. Let's fill in these blanks together. Thinking about cancer. What about external growth signals needed? There are no external growth signals needed for malignancy. There is no repair of damaged DNA, which results in loss of differentiation. The cells neither look like nor perform like what they were supposed to be. There are no alert signals when something goes wrong. There is no response to stop signals. This is malignancy. Cells do not stay within boundaries. Cancer grows by invasion, and that can result in distant metastasis, a tumor totally separate from the primary site. And this is cancer. There is no apoptosis. The cell mass gets larger and larger at different rates, depending on the type of cancer, but the cell mass gets larger. Cancer is immortal. There is no apoptosis. As we have been saying, a hallmark of cancer is loss of differentiation, that cells neither look like nor perform like normal cells, and cancer has uncontrolled cell division.
All right, we're going to stop there and take a break. You guys are doing a great job. Hang in there.